reason for worry in Arizona. Along with the rest of the nation, our COVID-19 numbers continue to track upwards. Cases and percent positivity continue, as are our inpatient and intensive care unit beds occupied by those with COVID-19. Regrettably, deaths from COVID the COVID-19 vaccine can get one. Effective vaccines are the light at the end of the tunnel, but that day remains months away. Until that day arrives, we urge everyone to remain vigilant. Wear a cloth mask whenever you are with someone you do not live with. Maintain at least 6 feet of physical distance. Wash and sanitize your hands often. Stay home if you feel sick, and avoid crowds. And now I am pleased to introduce Major General Michael McGuire to explain the efforts that went into turning this parking area into a medical facility. General?
Thanks, Dr. Christ, and good afternoon to my fellow Arizona citizens. I want to thank Governor Ducey, all of the Arizona state government partners, our county partners, our hospital systems, and the rest that allowed us to take the lessons that we've learned from the 1A pods, 7 of them, 5 in Maricopa County run by our healthcare systems, 2 in Pima County also run by our healthcare systems, to take best practices from those areas, take the planning staff from our emergency management folks in our agency, bring in assistance for logistics and planning from the National Guard, and then take that whole of community approach to get this pod up and running. As I've said since the beginning, the Guard cannot fix this problem, but to backfill the nearly 8,300 members of our organization that are going to get through this trial phase, get it up and running today, and it opens to the public tonight. And once we complete the capacity out to it, without that great partnership of all of the folks. And I want to once again make a call to everyone that is interested in volunteering to work through getting your vaccine, and then go to azdhs.gov/volunteer. It will personnel workforce to help relieve our guardsmen to get out to the rural communities and the tribal areas. And through it all, we've been laser focused on that 75 and older group, and this is the first deliver in all citizens. Expedite that and get into Group 1C as quickly as possible. And we could not do that without the people giving vaccinations, doing the observation in the medical spectrum. Pam Cahaley, President and CEO of Arizona Blue Cross Blue Shield, that's providing over 300 medical workers here at the site to give vaccines to the vaccine.
General McGuire, months have brought heartache and sadness. Spot of hope. I want to thank Governor Ducey, Dr. Christ, and Major General McGuire for having the vision to set up this site, and for these incredible partners to make this possible. Blue Cross Blue Shield of Arizona stands by you all with a heart of service and love for our community. The 2,500 employees at Blue Cross Blue Shield of Arizona are proud and honored to come to service. We are ready to work day and night, and we're ready to vaccinate Arizonans, and we're ready to put an end to the ravages of this pandemic. Thank you. I'd like to introduce, my pleasure to introduce Catherine Ivey of the Ben and Ivy Catherine Foundation.
Hi, my name is Catherine Ivey. I'm the president of the Ivy Foundation in Scottsdale, Arizona. Our primary mission is to fund brain cancer research, including our largest initiative, the Ivy Brain Tumor Center at the Barrow Neurological Institute. Last week, I reached out to the state of Arizona and asked how a grant could accelerate the distribution of the COVID vaccine. My job is more enjoyable when I get to work with a capable partner. Thank you, Dr. Christ, and everyone behind me and out there for your professionalism, transparency, hard work, and a great attitude. For me, today is about speed, efficiently accelerating the distribution of the vaccine. Having worked 15 years in funding brain cancer, I have repeatedly learned the impact on outcomes if you get ahead of a disease or an illness. Today, the line is going to move faster so we can all get back to work, get back to our families, get back to school, and get our lives back. To quote an email I received this weekend regarding the opening of this
Fuentes, the director of the Governor's Office of Youth, Faith, and Family, who will be speaking to our Spanish-speaking community.
Thank you, Dr. Christ, y muy buenas tardes a todos. Gracias por acompañarnos en otro importante paso para salir de la pandemia del COVID-19. Hoy, el gobernador Ducey y el Departamento de Servicios de Salud anunciaron que aquí en el estadio de State Farm va a abrir un centro de vacunación abierto 24 horas al día, 7 días a la semana, para ampliar drásticamente la disponibilidad de las dosis de vacuna de COVID-19 en el área metropolitana de Phoenix y en el condado de Maricopa. La vacuna ya está disponible en todos los condados de Arizona y estamos trabajando juntos para asegurar que estamos distribuyendo la vacuna en orden de las prioridades establecidas por el Departamento de Salud. Ya hoy, más de 124,000 trabajadores de salud a través del Estado han recibido la vacuna del COVID-19 durante la fase 1A. Y hoy comenzamos la fase 1B en el condado de Maricopa. El inicio de esta fase significa que la vacuna está disponible para trabajadores de servicios de protección, todos los maestros en el estado en el condado de Maricopa y todos los personal de las escuelas K-12, trabajadores de cuidado infantil y todos los que sean mayores de 75 años de edad. Por ende, todo el que cualifique en la fase 1A o en la fase 1B ya pueden registrarse para su vacuna en Maricopa. Información sobre las fases y en qué fase está su condado se encuentra en la página del Internet del Departamento de Salud de Arizona. La apertura de este centro de vacunación se hizo posible gracias a una generosa donación de $1 millón de la Fundación de Benny Catherine Ivy, con el apoyo de los Cardinals de Arizona, de Blue Cross Blue Shield y de la Arizona State University y, por supuesto, de nuestra Guardia Nacional. Este centro en el estadio de State Farm abrirá esta tarde, lunes 11 de enero. La información sobre el centro, las fases en todos los condados y cómo registrarse para su vacuna, visite las páginas del Internet del Departamento de Salud. Cuando llegue tu lugar en la fila, te exhorto a que te vacunes. Esta vacuna con ambas dosis es 95% eficiente en prevenir el COVID-19. Pero debido a que pasarán varios meses antes de que todos tengamos nuestra vacuna, por favor, sigan haciendo todo lo necesario para mitigar la propagación. Usen mascarillas de tela en la nariz y en la boca. Mantengan por lo menos al 6 pies de distancia. Lávense las manos. Quédense en la casa si están enfermos y eviten las multitudes. Muchísimas gracias y que se queden todos muy saludables.
Thank you, Maria. So over the past month, it's been my privilege to be among the healthcare professionals who have received both doses of the Pfizer vaccine. I'm pleased to report that I've had no side effects. Today, as we mark the opening of this facility, it's my privilege as a medical doctor to administer some of the first doses of vaccine here to a group of 14 educators and state troopers. So please take a moment to reposition while I head over to my other job today.
Okay, now's the time to reposition and throw people out of your shot. Mike? All right, thank you. As we finish the last vaccination, we'll set up here for questions for Dr. Christ and Major General McGuire. Hard to say with a mask, so please set up for that.
Do you want me to take questions? Oh, thank you.
All right, is everybody doing the Q&A? Who's doing the Q&A set up? I don't want anyone mad at us. Oh, we got one other one. Okay, let's go ahead and get started with the Q&A. Our first question is from Matt Galka, and then you, Jason.